Engaging policymakers is an essential component of the Building Community Resilience effort. The BCR Policy and Advocacy Guide was developed to help grassroots initiatives advocate for policy changes that promote resilience in individuals, families, and communities.
We moved from thinking about local partnerships and collaborations to address this issue to going to the policy level. And that really is a significant step forward.
BCR's Policy Guide compiles lessons learned from our teams across the country and builds upon key messages that have resonated with policymakers and community leaders. This year, BCR teams gathered in Washington, D.C. to meet with their representatives in Congress. Fundamental to the BCR work is bringing community voices to the table to ensure that the very people impacted by policy and practice are partners in resilience-building efforts. Each BCR delegation consists of community leaders and local coalition members representing different sectors such as education, healthcare, and economic development. Together, they presented a unified voice to policymakers on Capitol Hill.
BCR has helped, first of all, by helping us to get to the table. We say they need to hear those voices. Thank you, BCR, for bringing us to the table so that they can hear those voices.
Each BCR team brought stories to illustrate the pair of ACEs in their home districts. These stories help legislators and staff see how policies affecting funding streams and federal programs can help address childhood adversities and childhood trauma.
Almost all of them have something on their agenda that you can see trauma as a root cause. And I think helping them connect to how trauma is a root cause to that issue that they're trying to address through policy and legislation can be pretty compelling.
Even with ACEs, adults and families are really resilient, and making sure driving that message home was really key.
With preparation using tools and resources from the BCR Policy Guide, the teams delivered well-honed messages, pitches, and asks specifically crafted for each policymaker.
The advice that I would give is how to make the story relevant to that person that you're meeting with in that moment. We've had to be really intentional and really figure out what would engage the folks that we're meeting with.
There was a lot of questions around the types of programs that we really want to see moving forward, or these collective impact types of models. And the question kept coming up, well, give me an example of a program that Medicaid wouldn't fund. And we had several examples.
As we like to say in BCR, there are no stories without data and no data without stories. BCR delegations use data tailored to each congressional district or state using this BCR infographic. It can be customized to display local data on adversities as well as the strengths and opportunities in your community that can be leveraged to build resilience. There is also space to create specific requests for supports when visiting legislators.
We asked that they support the 3 major bills, and we got very positive response on all that.
BCR teams understand that advocacy doesn't just happen in the nation's capital. It sometimes starts with local leaders and congressional staff back home.
We offered to meet with their field office back in Dallas, to invite them on tours, to see the programs that are going on, to be available for information, research, statistics, anything that they needed.
Advocacy work may be new for many BCR team members, but they walked away from Capitol Hill feeling optimistic and ready to deepen these new relationships and forge sustainable change for a resilient nation.
This was my first visit to the Hill, and I was excited all day and just felt, really uplifted and energized.